Hello, everyone. Welcome to this month's edition of the Talking Tim webinar series. Thanks for being here. My name is Kyla Elzinga, and I'll help facilitate today's webinar. This webinar is sponsored by the Federal Highway Administration and hosted by NOCoE, the National Operations Center of Excellence. As a quick reminder, NOCoE offers a variety of resources to support the transportation systems management and operations community. You can go to NOCoE's website at transportationops.org to browse through links for TISMO resources and news. Previous webinar recordings and case studies can be accessed from the NOCoE resource pages. A few logistics for today's webinar. All attendees are in listen-only mode by default, but we do encourage you to stay engaged by using the chat box to identify your name, title, and the agency you represent. We will have a question and answer session at the end of each presentation segment. So if you have any questions, we encourage you to enter them in the Q&A area as they come to mind. It's a separate area from the chat box, but still available in your Zoom toolbar. We are recording the webinar, and the recording and slide deck will be available on NOCoE's website within a few days. Thank you again for attending today, and I'll hand it off to our moderator, Jim Austrich with the Federal Highway Administration Office of Operations to get us started. Thanks.
Thank you, Kyla, and many thanks to you and the National Operations Center of Excellence. I believe we're in our 8th year or end of 7th year, and it's been wonderful, all the support that the center provides us. So welcome to our family, my family, I like to say, the National TIM community. Good afternoon in some cases, and still morning in out west. So I took a quick look at the participant lists. Right now stands at around 84 or so. Many again of our friends, TIM champions and leaders. Next slide. So our standard disclaimer that we must share, and as you all know, the federal government, U.S. government, doesn't endorse products or manufacturers. You may see names and other identifiers, but we're here just to show and tell, if you will, and we're really happy to do so. Next slide. So that's me. Next slide. Today's schedule, you see it right here, self-explanatory. I'll make some remarks on the national TIM training statistics and exciting news that I've already started to share with many of you that every one of you that is involved with your TIM program, especially TIM training, we're going to need you to step up, and you'll be very excited like we are here at Federal Highway and our contractor team to share with you. We also have two great presentations, as you can see, one from VDOT's Clay Hicks and on their new IR app for situational awareness. And also Tim Reitz from Pennsylvania EMS, Bureau of EMS, who's going to share how they've gone about requiring the TIM 4-hour TIM training for their EMS community, which I believe they are the 6th or 7th state to do so. And that is a big deal, ladies and gentlemen. So pay attention to him as well, because we encourage you, especially if you have authority and you have the desire to try to expand the TIM training to your EMS community, which we have as an objective for sure going on through EMS post-crash care projects, I should say, and otherwise. And then, as Kyla said, we'll have some Q&A. Next slide. So unfortunate, there's good news here, but and bad news. This is the statistics for the year. 35 line of duty deaths. You see the breakdown there. Law enforcement led the the numbers this year again. Last year, I believe they were at 26 or 27. But regardless, one is way too many. The good news is this is, I believe, 23, 24% reduction total, less or decrease in fatalities from 2024. But again, this is something that we need to stay focused on and keep doing everything we can to not only do the TIM training but also market and advertise and raise the flag of the dangers that responders and frankly motorists as well out on our nation's roadways are always at risk on not only interstate freeways facilities, but even low speed facilities, etc. So, uh, next slide. Here's the total as of January 26th. It's a big deal. Note that number is, I believe, 156,300 and some odd shy of the 1 million mark. 1 million responders trained, all 50 states, DC, and Puerto Rico, which is part of that exciting news and big ask of all of you that you'll hear me mention in a few minutes. Next slide. Here you see as of November 17th through the 21st, which was Crash Responder Safety Week of last year, November 2025, right? I asked my contractor to come up with some stats on whether the event that we conducted at headquarters, along with all the work that you all did through your respective states, has paid off, and I think it is paying off. The difference there is about 4,000, I believe it is 4,100 responders that were trained above and beyond. And we're going to talk more about how we're going to finish getting to the 1 million mark and certainly continue our journey to the 1.4 million that we have identified, or the states have identified, combined all their responder population to be trained. So kudos to all the states that are already engaged and pushing the training. It's perfect timing, the beginning of the year, and I encourage all of you to keep doing what you're doing, please. Next slide. Here's the map. We affectionately call it the quilt map, showing the percent trained nationally. You can see that 1.4 million in the lower left. Of course, the key to the right that shows the number of states that have reached a percentage. Their goal of responder population to be trained is identified in the parentheses below the percentage. I know of one state that's interested in adjusting their number, but I won't put them on the spot. I just can tell you that this effort was started back in 2014, 2015, and this is how we continue to track the national picture, if you will, of the TIM training. And it's a big deal, ladies and gentlemen. It really is a big deal. Keep up the great work. Next slide. So I mentioned interesting development that occurred during Crash Responder Safety Week, specifically with our administrator, Sean McMaster, Federal Highways Administrator, who was our keynote speaker at the event at headquarters on that Monday, November 17th. He, along with the NITS administrator, Mr. Morrison, and Mr. Barr, B-A-R-R, I believe it is, for Federal Motor Carrier Safety Administrations, all three modes, all spoke at the event, along with the Deputy Secretary, I believe Mr. Bradbury for US DOT, spoke at that event. And from that event forward, launched what I'm about to tell you, which again is a huge deal. The administrator is the one asking all of us, declaring a call to action, and a high priority call to action to get to that million responders trained. Try really, really hard this year in the next 11 months, if we can, train that 156,000 responders to get us to that million. If we miss it by a little, okay, we'll clean it up, I guess, or get to the million in early 27. But I really think with all of you and the efforts that you're going to embark on, hopefully, after these workshops, DFS stands for Director of Field Services. These four regions that you see down in the lower right key, West, Mid-America, South, and North. They're part of a program internally, the Federal Highway Administration, comprised of the states, a number of states that you see there. We're going to conduct workshops, virtual workshops, regarding the responder training. We're going to invite not only the division office representatives from each of those states to be a part of the workshop, led by my office, my contractor team, and we're going to invite also many of you, if not all of you, but most of you who are the key state points of contacts for your state, for the overall TIM program, but certainly the TIM training part of your programs. We're also going to ask you and coordinate with you to invite your 5 top trainers. Some of you have more than 5 high-performing trainers, and whether they train, 10 classes, 10 4-hour classes a year, or 20, or one every quarter, whatever the case may be, it's going to be a fairly it's going to be an exciting workshop to have discussions on how we're going to get to this million mark and above. We've asked my office through a bunch of meetings, and we've had several meetings over the past 3 months or so since CRSW, that were called by the administrator himself, Sean McMaster, and his staff and our public affairs folks, and Federal Highways Office of Operations, my boss, Mark Curley, and our team leader, David Johnson, and myself, in meetings with the administrator on how we can achieve the million. And this is going to be one of the primary vehicles that we're going to use to communicate to the nation on really ramping up the training. And so many of you already do this, but hopefully maybe you'll be able to do even more. And certainly the states that aren't producing as much as they could, let's say, are going to do a lot more and collaborate with us to get to this lofty goal of a million or more. So we'll have discussions, and the webinar is probably going to be an hour and a half at the most, but we'll have all kinds of discussions regarding the programs, the individuals, the trainers, if they have any unique ideas or ways. And we're talking about in-person training primarily here, but we're not discounting the online training that exists either through our training arm, the National Highway Institute, or respondersafety.com, that a lot of our volunteer firefighters and other remote responders that can't get to in-person classes take advantage of the online course at Emergency Responder Safety Institute. So, next slide. Included this slide again. If you haven't taken advantage of this link that you see here, this site, this is the portal, the TIM Training, the TIM Trainer portal. If you are a graduate from any of the train the trainer workshops, you should have by now your credentials to log on to this site to view statistics, upload your training stats and access any and all of the materials that are there for your support, for you to use for your training efforts. So obviously, we're going to talk about this site on the workshops that I just mentioned, the DFS workshops. So if you're interested, please take advantage of this. And if you have any questions, feel free to reach out to me. Call me or email me. Next slide. And with that, I have the honor of introducing Clay Hicks, our first presenter, who's a program manager for the Virginia Department of Transportation Traveler Information Suite. In his role, he manages VDOT's 511 Virginia website and mobile apps, its statewide traffic camera video distribution, its Smarter Roads open data portal, and its relationship with commercial navigation firms. He is a retired colonel from the U.S. Army and later worked 10 plus years in program management in the Department of Defense intelligence community. Clay holds a master's and a BS, bachelor's degree in computer science and is a program management professional, holding that credential. Over to you, Clay.
Hello, everyone, and thank you, Jim, et cetera, for the invitation. Next slide, please. Let's go to the next one here as well. So the reason I've come to you today is I want to talk about how Virginia DOT, or VDOT, is attacking a problem that I dare say is common to virtually every state DOT, or at least most of them. And that problem is how to get easy access for responders and supervisors to the common operating picture, the COP, of what's going on with the mitigation of a specific incident or crash. So take your average, your garden variety highway crash, and you've got two groups that are trying to work together concurrently. I call one the stakeholders, and I'm sure you understand who these folks are: police, fire. The Traffic Operations Center, or TOC, is probably pretty central. I know other states call them TMCs or something else. And then you've got a list of tasks or goals that all of those stakeholders are trying to accomplish. And I think you can see where this is a pretty vanilla list. Next slide. So for communication and coordination in what I'm calling the old way, which is how we used to do it, the different sets of stakeholders use, shall we say, less efficient and desirable ways of communicating. You got people on the phone, you got people on the radio, you got folks using email, and I know that we use a lot of email distribution lists, especially to accomplish executive notification. Folks are on Teams and Zoom chats. And next slide. Practice has shown that these are stovepipe. You get small groups that are talking among themselves, and there isn't really a good way to get that information out to the group. Virginia has been relying, like most states, I would think, primarily on email, which means that people get tied to their inbox. And who wants to do that with several hundred, if not more, unread messages in your inbox? You spend too much time checking for updates and rechecking. You're on the phone, you're trying to reach people, you can't reach them, you leave a voicemail, you have to wait for a callback. Collectively, you're not necessarily sure about who is already aware of an incident and actively working it. And that tends to lead to, are the right resources? Have they been dispatched? In general, it's just tough to understand collective progress. Next slide, please. So the way that Virginia is now tackling this problem, we have instituted a mobile app that we call VDOT Incident Response, or IR for short. It's designed primarily for folks who respond to the scene, but as we've seen in its use, it's really valuable for supervisors and executives as well. Right now, it's non-public. It's only open to VDOT employees and a handful from the Virginia Department of Emergency Management. It's a mobile app, so Android and iOS versions that works on smartphones and tablets. The desktop version, an actual website, is coming. We hope to launch that, next month. It's almost ready. Next slide, please. So what is the IR app and why is it valuable? Well, it gives you the tools to do these things. You can see in near real time, every incident in the state that VDOT is working. We use the IR app to do executive notification quickly and easily. The app gives you access to photos, the TOC operator notes that contain all the details of who's where and who's working on what. Overall, you can spend a heck of a lot less time gathering all the information that you need. And of course, it gives the folks working public information or communications, whatever you call it, the ability to get current status, to be able to craft up-to-date and accurate public messaging. Next slide. So our IR app, in the first place, it's built on top of our public 511 app. So that means that IR does everything that 511 does, plus all of the IR specific features. As I said, you can see every incident being worked in the state, see photos, lane status. You can subscribe within the app to get push notifications to send you updates without having to even look at the app. It can help you ensure that the right people are aware of an incident and actively working it. As it says there in the bottom, the goal is to find current data with minimal clicks. But the unspoken part of that is we've structured this to make it so you don't have to pick up the phone. You don't have to call anybody. You don't have to deal with voicemail. You don't have to read or send any emails. In fact, you can get all this information without talking to anyone. Next slide. In Virginia, we divide our state into 9 different districts, and they're serviced by 5 regional traffic operations centers. One of the great values of the IR app is that it's very tailorable. You can configure your version of the app to tell you as much or only what is of interest or what you need to know. For instance, if you are working in the Bristol district, which is in the southwest corner of the state, you probably don't really have a big interest in what's going on in Northern Virginia by DC or in Hampton Roads out by the beach on the far eastern part of the state. Next slide. So when you first start using the app, the first thing you do is you set up your own user dashboard. And again, this is where the tailorability comes in. The graphics that I'm going to show you are taken from a tablet because they're just easier to see than graphics taken from a smartphone. So the first thing you do is you decide from what perspective you want to track this information. Because my position is statewide, I look at the entire state all the time, and I do it at the TOC level because it fits nicely on one tablet screen. In the graphic on the right, you can see that there are 6 basic groupings of information. The bottom 5 represent each of the TOCs, and then you have a statewide aggregation or roll-up up at the top. And you can see the number of incidents that are currently being worked and also their severity level, level 1, 2, and 3, which I assume is a common term among this group. And then, of course, there's the executive. It's not a level, it's a category. It's an extra qualifier that's based on criteria. Like, for instance, in my state, say you had a school bus that was into a very minor fender bender with a passenger car and everybody's on the shoulder and traffic is not affected at all. That would normally be a level 1 incident. But in Virginia, because it involves a school bus, that fact alone, the commissioner is very spun up on it and he wants to know immediately. It goes immediately to executive category and the notification goes out. You can also subscribe to get push notifications about incidents that are of interest to you. And I'll talk about that in a minute. Next slide, please. And here's something about push notifications. If you opt to subscribe to them, you can get a push whenever there is a new incident or a change in the severity level, or when an incident has been finished, worked, and it disappears from view. And again, this applies to only that portion of the information statewide that is of interest to you. And if you have any of these on your screen, you can simply tap on it and the app will take you to the detailed explanation of that incident. Next slide. So again, with one tap, I can go down from my statewide dashboard to say, for example, one of the TOCs. I happen to pick Richmond here in this example, and you can see that using they're kind of hard to see on the screen, but the blue and white bells along the left side up towards the top, this tells you what you're subscribed to in terms of push notifications. If the blue bell is filled in, it means I've subscribed. In this case, I'm getting pushes for level 3 and executive incidents. And if I'm not subscribed, the bell remains white, and that's level 1 and level 2. I mean, if you subscribe to level 1 information, your phone is going to be blowing up all day long. In this particular example, Richmond is tracking 3 incidents. They are, I think, 2 disableds and a garden variety level 1 crash. And what you can see on this screen is just some basic information, what type of incident it is, generally where it is, and then a timeline of where we are on the way to finishing mitigation. Next slide, please. That's with one tap. I can pick any of those incidents on the previous screen and tap it and go down to the incident detail level. What I'm going to do now is take you through the information that you can get at the incident detail level. And as I do that, I would like you to think about, if you were a responder or a supervisor or an executive, and you could get all of this information just by tapping your phone, no telephone use, no email, no voicemail, etc., how valuable would that be to you? So at the top, you get a reminder of the severity level, the type of accident, where it is, county, ATMS incident number. So beginning here and on the following screens, what I'm going to be primarily talking about is what's in the yellow outlined box. So on this first screen, there's 4 different buttons you can tap. The one on the left says map. If you tap that, you get the 511 map view of this specific incident, where you can see nearby major roads. And best of all, you can see the live feeds from any traffic cameras that can see the incident. The second one is directions. You tap that, you get turn-by-turn directions from where your mobile device is right now to the incident. The third button, call the TOC. If you tap that, your phone dialer will come up with the phone number of the responsible TOC already populated, and you can get a hold of them that quick. And the fourth one, which is a white bell, you hit that, and you subscribe to push notifications for this incident. That's the lowest level you can get. Next slide. So continuing down, this is, you saw this primarily on the TOC level dashboard. We have a timeline here that has 3 common milestones involved in any kind of incident mitigation. And we based it on the Amazon model of ordered, shipped, and delivered. In this case, it's event start, lanes clear, meaning traffic can flow again, and scene clear, which is when all personnel and equipment are clear of the scene. You can find out how long the incident's been running, what started, how much delay miles, congestion there is. And then there in the bottom left is a really useful piece of information. It says incident details, vehicles 1, fatalities 1, injuries 1. This is designed to give the viewer a sense of the scope of the incident, especially if there's a fatality and you're trying to figure out how long this incident might continue to be worked. A fatality could involve reconstruction, which tells the viewer that this one is going to be going on for a good while. Next slide, please. So this is the staff viewed incident section. You see all those gray bubbles each with a set of initials in them. If you tap on any of those gray bubbles, you'll get a small pop-up window that identifies that person and their job title and the time of day that they most recently viewed this incident here on the incident detail level. This is where you find out for certain who's working the incident and how long they've been involved in it. We're in the process of adding job titles to it. Don't have that for everybody yet, but the value here is it helps you to coordinate resources. If you know who's working the incident and their jobs and responsibilities, you get a good idea of what's been done and what still needs to be done. So instead of tapping one of those gray bubbles for which you get one person's info, most people tap the all button there on the far left. Next slide. And you get a scrollable list of the date and time, name, and title information for everybody who has viewed the incident so far. You see my name there at the top. I've got CO, Central Office, Traveler, Info PM as my job title. We're still adding all the other titles. It's going to take a while. Next slide. Continuing on down the screen, we come to what we call the lane closure widget. Now, this is simply a graphical representation of the configuration of the highway at the point of the incident. And it's updated. It's originally created and updated by the TOC operator. And what you see is the number of travel lanes in each direction and whether or not a shoulder exists. And they're color coded for whether they're open and closed. So in this case, the roadway has one travel lane in each direction and both sides of the roadway have a shoulder. The northbound lane and the northbound shoulder are closed because they're red. Everything else is in green. Next slide. And then we come to the photograph section. This is where scene responders can take photos at the scene and upload them to the app to make that available for everyone to see. A picture's worth 1,000 words. It helps you understand severity and the type of resources that will be needed to efficiently mitigate it. And like any app that involves photographs, you can tap on any of the photos. Next slide. And with a finger pinch, you can zoom in and zoom out, upload, download, whatever you want to do. This is a guy who took a corner way too fast and met a tree. And, well, there were 2 people in this car, and believe it or not, one of them lived. Next slide. Then at the very bottom, the last piece of information is probably the most valuable. It's the TOC operator notes. It's a textual thing. It is the official record of everything that's been done, and it tells you in chronological order every event related to mitigation of an incident. Here is where you can really find out who and what has been done, what resources are already on the way, who's there on scene now, who's already cleared. It tells you about fire, police, EMS, ambulance, wreckers, tow trucks, highway maintenance people. This is where you can find out virtually everything you could likely to need. Next slide. So that's it for one specific incident. And I ask you to try to assess whether you think that would be valuable. You've seen this slide before. I showed it to you early. So make your own assessment as to whether you think it's a valuable tool. Down there, the red and yellow box at the bottom is our favorite piece of user feedback that we've gotten so far. We had an interstate maintenance guy make a comment that using this app is like having a TOC in your pocket, which is exactly what we want. We want you to be able to get everything out of the TOC without having to talk to them. Next slide. So that's where we are today. I want to talk about just a few of the major upgrades we have planned for the future. The first I mentioned is an IR website. That's already almost done. The next one is a chat room function for each specific incident. So when this is implemented, if you're looking at an incident at the detail level, you're automatically eligible to join the chat room for that incident. And that's where you can discuss your tactical plans and talk about what do we need and what's already on the way. The hope is that we can pull everybody away who still lingers in Teams chats and email and radio and bring them all into this chat room so that everybody can see all of the talk and planning that's going on. The next item is what we call a pain point subscription, where you can set up a subscription so that the system will notify you of a new incident that matches any kind of criteria that you specify. For example, if for whatever reason you really want to know about something that happens on I-81 between mile markers 4 and 30 that's in a work zone and that has either an injury or guardrail damage, you can set that up and you will get that pain point subscription notification as soon as that incident hits the system. It doesn't get any quicker than that. Another example, if you want to know about anything on Route 360 in Bedford County that involves hazmat, you can set up that subscription. The next to last button there is right now, when an incident gets to the point of scene cleared, it disappears immediately from view, which is not always convenient. We're going to try to make the ability to reopen incidents that have closed within the last day, 7 days, or 30 days for further review. And another item there is we want to add the mapping of crossover and turnaround points that will help scene responders come up with detour routes and also to help clear the trapped queue of traffic that's immediately behind an incident, but already past the closest exit point. So there are others. These are just the priority ones that we're basically looking for. And next slide. Yeah, that's all I've got for you today. Thank you very much.
Great presentation, Clay. There are a couple questions. Vishali, are you going to field these or you want me to?
I think we're going to do the Q&A at the end. So we'll come back to the questions, but for those that have additional questions, please do enter them through the chat, the Q&A feature, that button at the bottom center of your screen. So back to you, Jim.
Okay, very good. And thanks again, Clay. Really cool app. And I'm sure everyone here can appreciate the value of having instant information access to especially high visibility, high priority incidents that are occurring in the transportation system in Virginia. So very good, very good. So with that, I'm going to introduce here Tim Reitz, who, as you can see in his beautiful uniform, EMS practitioner, and currently the EMS program manager for education at the Pennsylvania Department of Health, Bureau of EMS. Prior to this, he served as a director for the Duke LifePoint Conemaugh, I think. I hope I didn't screw that up too much. Conemaugh or Conemaugh Memorial? Conemaugh Memorial Medical Center School for EMS for 25 years. He has a master's degree in instructional technology as a certified EMS educator, a fire service instructor, and paramedic. He also teaches several other healthcare disciplines and is on various committees and boards. Tim has been a volunteer firefighter for over 30 years, the last 10 as fire chief. So, welcome again, Tim, and the floor is yours.
Thank you for having me, and it's great to be here and to be able to talk about this wonderful opportunity for things that we've been able to see happen in Pennsylvania as it relates to traffic incident management and the wonderful ability to bring training to our upcoming certified providers in Pennsylvania. So one of the things that as we go through this, we'll kind of bring this into how we were able to bring Tim's training into reality for adoption into our EMS education system, and we'll just bring in hopefully a little bit of a roadmap for everybody that is on the call today to give you some, I don't want to say ammunition, but to give you some resources to be able to go back and take a look at things and say, hey, maybe these are things that we can take a look at. Some may not always be very popular with people, but remember that our number one priority here is the safety of what our folks are doing out on the roadway, right? We're out there to make sure that we're protecting the citizens of not only our Commonwealth here, but everywhere across the country. So next slide, please. One more. There we go. So our first area that we really started to take a look at is, as you all know, Federal Highway has the version 4 of the responder training program. And we were first really taking a look at different things and found that the National Fire Protection Association does have a standard for traffic incident management, which is identified as standard 1091. So 1091 is in the National Fire Protection Association. And this standard really has been put in there, has kind of, I don't want to say crept in, but has been sitting in there. And I want to say that it's been more dormant than anything. So one of the things that we started to do in this process, and I'll get to part of the history of it, is that we started to look at what the National TIMS program was actually able to do. So through the National Association of State EMS Officials, I had communications with through their subcommittees. I had reached out to Jim as well and said, hey, has anybody really taken a look at the standards or the job performance requirements for 1091 and under their new standards, and really compared to what TIMS 4.0 or 4.0 is all about? And we really weren't 100% sure, so said, hey, let's take a look at this. So we broke down the 4.0 of the National TIMS program, and we did compare it and found out that truly the National TIMS program does compare and meets all the JPR requirements for NFPA 1091. Well, this was a great thing to find because it provided us with a little bit more ammunition for something else. And you're going to see how we started to blend this in as a precursor just over about a year and a half ago. Next slide, please. So it leads us down the fact that we know that there are traffic crashes that occur all over the place. And we just saw a wonderful program that is occurring in Virginia to actually identify different ways in which we can see different levels of or different tiers of crashes. Well, NFPA 2500 starts to talk about the way organizations are going to be set up and talk about the way that site control and scene management is going to be in compliance. So this talks about vehicle rescue. And one of those things talks about the way that scene control and site management has to occur in accordance with NFPA 1091. So again, you start to see that NFPA 1091 starts to creep in some of these other NFPA standards. And we started to go back and say, 2500 is now starting to refer back to 1091, which is now leading back to traffic incident management. Next slide, please. At the time that we were looking at a lot of this, Pennsylvania Bureau of EMS, which falls under the Pennsylvania Department of Health, has in our regulations that we do have the ability to certify vehicle rescue technicians. So we work with our partners at the Fire Commissioner's Office in Pennsylvania, and we work on what we affectionately call together, the Joint Vehicle Rescue Program. So at the time this was occurring, we started working together in 2023 to update our material for Passenger Vehicle Rescue 2024 to come into compliance with NFPA 1006. And this meant that we had 3 different levels that we had at. That meant that we were complying now with NFPA 1006, which also had oversight from NFPA 2500. When we started to look at this, we said, hey, you know what? We have to make sure that we have individuals that come into this course, they need a prerequisite. Those prerequisites not only need to have the NIMS programs is part of 100 and 700. We also need to make sure that they also have the hazmat awareness. They also need to have the traffic incident management because that is in 1091. 1091 is part of the 2500 program. Now, one of the other things that you're going to see here, and we'll come back and visit this here in just a few minutes, is that we also have the fact that these individuals to enter into this program only need to be 16 years of age. So we now start to realize that we're also dealing with the fact that we have children, and that's exactly what they are. They're under the age of 18 that are volunteering in these aspects of typically fire and in some cases EMS agencies or rescue services that only have to be 16 years of age and they're serving on a roadway. So it makes sense in this case that they're actually going to help secure the road and it makes it a little bit safer for them. So that was the first start of this process. They had to have these things on the first day of the class or they weren't able to go in. So it was the entry ticket into the program. Next slide, please. So we didn't meet a lot of resistance in that aspect because we realized that people understood that there was motor vehicle crashes and that we were making sure that people were safe. They understood about the hazards. They understood about being on a roadway. They understood that we needed to make sure that there was tapers, that they were going to secure the scene. And therefore, we wanted to make sure that things were being taken care of. So that part took care of everything in 2024. So as things were being taken care of in 2024, we also started to take a look at the fact that what are we going to do with our new upcoming certified providers? And were we leaving a gap in the education? So we referred back to the 2021 EMS education standards, which is what Pennsylvania adopted. Now, in the EMS education standards, there is really no mention about tapering. There's no mention other than securing the scene. And there's mention about driving an ambulance, and there's mention about making sure that you park in a good manner, but there's no significant depth and breadth that is mandated in the curriculum. So it was totally dependent on the local agencies or the authority having jurisdiction at that point as to how those education standards were going to be implemented. We started looking a little bit further and remember that we had kiddos that were now going to be in the volunteer side of the fire rescue industry that were already extricated out of vehicles. What are we going to do with the 16-year-olds who could be certified in the Commonwealth of Pennsylvania at an emergency medical responder level or at an EMT level that are also getting out of an ambulance? And oftentimes the reality is on a motor vehicle collision, they may be the first agency that is on the scene of a crash because during the day, most volunteers are working. So that means that how do they secure the scene and how do they allow or set up tapering of a car crash that's actually going to be effective? And under the child labor law, they are not allowed to be on a roadway unless it's closed. So we realized that there was a significant gap. And how did we need to fix that? So we really started to look at that aspect, and we said, it is now time that we probably haven't addressed this, that we now start to adopt it. And that's exactly where we started to go with. We started to look at this and said, as the Bureau, we have the ability under our law to be able to look at the education that is existing across the Commonwealth. We came in and said we have the ability under the EMS education standards that it allows us, that since we adopted it, to be able to react because it is something that affects the safety of all of our providers. It is time to get away from the scene safe, gloves are on type mentality and actually have people do something for real and start setting up the process of teaching people how to set up a taper, how to potentially set up earlier indicators that there is a crash ahead. How do we make sure that we're protecting our own providers that are on a roadway and making sure that the ambulance is positioned in a way to make sure that we're loading patients in a correct manner. And as we start to do these things, we realize that TIMS is the way to go because it has all of those little checkoff things in there that we realize to keep people safe. So that was why we started to put that into play. So these were things that were discussed with a lot of our stakeholders. We have 13 regional councils, plus we have an advisory body, and that's where we started to go to. We went to these folks, we met with them, we discussed these things. And next slide, please. And after we got all of their input, we came back and our director was very proactive in saying, I believe in what we've all discussed. And therefore, in October of 25, it was very strongly pushed out that in January 1st of 2027, this will now be a mandate that all educational institutes accredited by the Pennsylvania Department of Health, Bureau of Emergency Medical Services, any provider that is going through an initial certification program at an EMR, an EMT, an advanced EMT, or a paramedic level will need to have this completed as part of their initial training. And as a result of that, we took a look at what the resources were. Next slide, please. And those slides include the fact that we have a learning management system that is already set up in Pennsylvania. It's called Train PA, where we do have the FHWA version or Pennsylvania version that is set up through the Pennsylvania Turnpike version of it, which is through the Traffic Incident Management Training Program. We also know that the FHWA has theirs online as well. And we also have through respondersafety.com, or can also be done in person. Any of these programs are totally acceptable. The point is that we need to be able to get this education out. And we want that education to be readily available to all of the providers that are initially taking that initial certification program. So it is our first step that we have to do to start moving forward. And is that something that we believe that we're the only ones that are going to be doing that? And I think the answer to that is probably no. Is that a move that our state or the Commonwealth is actually doing right now just for EMS? And the answer to that is no. Next slide, please. What we did find in our conversations with our partners over at the Fire Commissioner's Office is that when we discussed a lot of this, it was also found in NFPA 1010 that in Chapter 10 of NFPA 1010, I know a lot of 10s here, that emergency medical services is truly identified there. And in that section, it does identify that anybody that is listed in NFPA 1010, they need to have an equivalent program for traffic incident management as identified in NFPA 1091. And that is something that is determined by the authority having jurisdiction. Now, that is up to either your state or a commonwealth such as Pennsylvania, where we are the authority having jurisdiction over that educational aspect. We're looking at it from a certification aspect as well. So this is something that is truly what we're dealing with at this time for EMS. One of the other things that we have worked with our partners over with the Fire Commissioner's Office in is that they too have changed their curriculum for fire training and they are instituting the mandate for NFPA 1091 in TIM's training as well. So in that conversation, they are instituting theirs in the middle of this year. So I believe it's June or July of this year that they too must have anybody who is taking initial fire training must have instituted the 1091 or TIM's training as well in the same manner. So I think we're going to see a lot more of in-person as well as online training from the fire and EMS sections of the provider section of Pennsylvania because of these mandates. And our hope is that since that has really hit in NFPA, that we'll start to see that other states will start to pick this up as well and start this national trend that it is that important, that it's standard. It's not a law, it's a standard. Start taking a look at those standards. A standard is just one step above that level of incompetence. We're just above there, and that's what we want to be able to see. Or I shouldn't say incompetence, above inadequate. And we don't want people to be out on the roadway to be inadequately trained. We want them to be adequately trained, and we want them to be above that level. So that means that we want to make sure that everybody is getting prepared for that. So that's essentially where we started to come from and how we got there. So that's the process. We are just now under 11 months away, or just over, I should say, 11 months away from full implementation. And we're excited to see that this is going to be a process with that. We are working on updating our PA Train program to make sure that it's compliant with the newer versions of the FHWA program, and make sure that all that recording of the training to reach our million gets there, so that we can make sure that we're part of that whole goal setting aspect there. And next slide. And I guess the whole thing here is that timing is everything. As we worked through here, it was one of those things that we started to dig into the data. We started to look at the standards and said that either we could choose to ignore the standards or we could choose to help set the standards. And we said, it's time to move on. Don't be too late in setting these things. I would have loved to set this at the same time that the fire commissioners did. Unfortunately, we know that there are programs that start and it would probably be too much of a lift for them over course catalog changes and everything else. But we felt that now was the time to actually set it, and we gave them from October until January 1st of 2027. And there's my contact information if you are looking to see ways in which you have questions in the way that we try to enact some of this. Please feel free to reach out, and I'll be more than happy to give you a hand.
Outstanding, Tim. Chief, I will add, Chief, thank you for all your efforts, and I can't wait to see the increase in the EMS community, the increase in the EMS personnel completing the TIMS course. And your point about just offering folks here on the line that may not be exactly in your position, but still may be willing to push the envelope and talk to their comrades in the EMS community to see if they can do similarly in their state. You guys heard me mention there's six other states that have done this, Tim, that I think I told you about. I know Florida, Connecticut, Georgia, Kentucky, Alaska have done similarly. And this is a big deal. So I think our audience here should take advantage of what you've done here and your willingness to help out. So I am going to, against Vashali's probably thought, to do the questions for Clay first. I don't see any other questions in the chat bot for Tim, but we do have some other questions here that I'm just going to read out to you, Tim, if you don't mind. Let's see. First one being prior to this. Well, no, that's not your question. That's your bio. We
Yeah.
often hear that, yeah, we often hear that EMS and other response professionals already have significant educational slash training requirements. How did Pennsylvania Department of Health successfully prioritize the National TIM Responder Training and make it as a requirement for EMS professionals? How did you turn the naysayers?
Well, so we still have some naysayers. Some of the naysayers actually just, their thing is that it's more paperwork for folks to look at. I think a lot of them seem to have really come forward with the fact that they realize that it is more of that we didn't realize the gap that was there for the safety aspect of things, and particularly blocking roads and doing tapers for our providers. So I think that was a big thing, and I think we're probably seeing that some of them are actually doing more embracing of it than more of the naysayers. But I will also say that we will never ever make people 100% of the time happy. So we've had more positives than negatives. So I'll leave it at that.
Yeah, I've heard similar from these other states, but you kept pushing and you got it accomplished. So kudos to you, Chief. Here's another one. Are there outreach efforts that Pennsylvania Department of Health is considering to help accelerate the adoption of the training in advance of the January 1, 2027 timeframe?
So we've continued to really push people to not wait to the last minute. That if they're bringing students in now, particularly at the programs that are going to take a little bit longer to complete, such as paramedic or advanced EMT, that they go ahead and they start encouraging their students to get those things taken care of now. That they get those things done as prerequisites. And if they're going to be cross-trained in fire and then come over to EMS, to get those things taken care of now, so that it actually just spans over time, and it'll make it a lot easier for them. They won't have to worry about it later on, so they're not getting bogged down with other prerequisites that they may have to do for other programs.
Very good. Last question here. Do you see extending the requirement to the 1 hour refresher training?
So right now we have had some of that discussion, particularly for how are we going to do that for the current providers. We are definitely encouraging that at a employer level, encouraging them to make that as a requirement for their employers or for their employees to have for traffic incident management. And I would like to see that in the future, that there be a form of a requirement for it. It may be something that right now in Pennsylvania, we do have a certification for driving an ambulance. So a program such as a 1 hour TIMS refresher would count towards that driving in an ambulance refresher. So I think a lot of people would buy into something like that, since it would count towards that and also give them the traffic incident management renewal.
Very good. Very good. Okay, well, thank you for that and your presentation, Tim. I'm going to move over to Clay's questions with VDOT regarding the IR application. Clay, are there any issues with FOIA requests, Freedom of Information Act requests, are using state-issued cell phones?
Yes, we're using state issued cell phones, but the app will work on a personally owned device as long as you have the state verification, identity verification software loaded to give you access. In terms of FOIA, yes, we have thought about that at great length. There are issues in that anything that gets put into the operator notes, et cetera, becomes part of the permanent record for an incident and therefore subject to FOIA. Right now, the app is read only. The only thing that users can do that might change that record is upload a photo. The concern is that once assuming we open this up to other agencies, state police, fire, ambulances, tow truck drivers, whoever, then VDOT loses control over what gets said and then simultaneously gets added to the formal record. And especially if someone was to take a photograph of something that we definitely don't want to be in the record, such as, badly injured person or a deceased person, we currently don't have any good way to get that photo out. And we don't want that part of the permanent record because it's FOIA subject. So the answer is yes, but we don't have the answer. We don't have the way we're going to handle that yet.
Got it. Another question, what was the schedule and budget for the IR app?
Oh boy. That's actually before my time. I've only been with VDOT for a year. I know the first, I call it fledgling version, came out, I want to say late 24.
Okay.
The budget is, I don't even want to speculate.
No problem. How well was it received by so far by VDOT crews and others?
Oh, enormously. The feedback is universally positive. We're
I bet.
adding new
Yeah.
members almost every day. We're closing in on 400.
Very cool. Very cool. Let's see. What is the retention schedule with these entries?
You mean how long does it go before VDOT deletes everything related to an incident?
Yeah, I'm pretty sure that's what Deanna Brewer from Washington State DOT is referring to.
Well, everything the ATMS does is backed up in storage. So I want to say we never delete it. It just may take a while to get something that's really old out of archives.
Yeah, sometimes it's like 30 days and it automatically,
Archives, yeah.
yeah, deletes or archives. That's right. And then another question regarding the app. Do you have good compliance with adding information?
Yes, but as I say, right now the app is read only. The information is entered primarily by the TOC operator. And one of
Right.
the reasons we want the app to move over to a chat room is it will take a lot of that burden off of the operator who is already very busy with other stuff.
Right. Okay, it makes sense because the second part of the question goes to what you just said. Does the TOC enter it, most of it, and then the field staff, law enforcement, et cetera, do the updates? Or how is that communicated?
Right now, it's the only person that can change the record, update it, is the operator. The operator takes in information from a lot of different sources, but he or she still has to type it in.
Makes sense. Makes sense. Okay, well, I do not see any other questions unless Vishali or Kyla, do you see any other questions that I'm missing?
No, I think those were the key questions asked from the audience. I think there were one or two questions still that we were interested in hearing a little bit more from our presenters. So, Jim, I'm not sure if you want to tackle any of those or not.
Go right ahead, Vishali.
Okay, sure. So I think one of the questions that we had for Clay, and you've touched on it once or twice already, but in terms of the deployment of this app and the expansion of the app, what do you see as sort of the challenges and timeframes to have it more broadly shared beyond VDOT staff?
Yeah, I understand. Creating a new account is really simple as long as you supply an acceptable email address, which right now has to be VDOT. We can see the obvious value in expanding the circle of agencies and entities that we would like to give access to, because fire, police, etc., they would benefit from having this information at their fingertips. Our TOC operators sit literally shoulder to shoulder with state police dispatchers in our TOCs. The FOIA issue is that I mentioned is a problem. There's a general reluctance to add in the world, because once we do, we will lose control over who can send and say what. I mean, our communications people have even made a suggestion that through social media with crowdsourcing, we could even consider uploading photos of incident scenes taken by members of the public. Of course, that would take a lot of filtering. So it's a matter of how wide do we want to cast the net.
Very good point. Jim, I don't know if you want to add context. There are other state entities that have apps that they use. So I was thinking of New York State DOT's IR app, Incident Response app. Or, some of the Safety Service Patrol apps. Have you guys thought about, Clay and Jim, please provide, what prioritization of features or capabilities you want to move towards? Have you talked to some of these other entities?
Not to my knowledge. In fact, through this webinar today, I've learned that Washington State and now New York State have something similar, and I would very much like to find out more about that.
Yeah.
Okay.
And
I'm
I'm
sorry.
like Dave.
The prioritization of upgrades, that is almost completely driven by user feedback. We take and always prioritize and reprioritize what they want to see to make their job easier, and then we figure out which ones are feasible and affordable, and then we make them happen.
Yeah.
Excellent. Thank you.
And
I don't think we have any other questions. So, Jim, I don't know if we want to close, or if there's anyone that, wants to share any more questions through either the Q&A or the chat.
yeah, for sure. The thing I want to say too is Vishali always manages to keep things interesting. I'm not aware of New York State's app, or you mentioned another one. The one I'm most familiar with is the one from Washington State, the VCC, the Virtual Communication Center, I believe. And the yesterday during our pool fund study, Safety Service Patrol pool fund study call, Deanna Brewer, who's the statewide coordinator, talked about the VCC. And I mentioned Clay was going to be on talking about Virginia's app today on Talking Tim. But yeah, apps abound, and I'm sure there's even more that we're not aware of. Certainly good. Anything to minimize the amount of responders and officials for DOT and other response agencies to have to use devices, radios, and laptops and all these kind of things is a good thing, right? Minimize, just point and click kind of thing, and you're able to find out, the status of an incident and those sorts of things. So there's Deanna there chiming in, and the VCC, I believe I heard Deanna say yesterday, they they do not have a 511 system anymore. So they're really relying and well, they really like their VCC system. Of course, Virginia still has theirs, and the IR app is on top of the 511, if I recall. Clay's Clay sharing that as well. So anyway, is there anybody that let me see what's in the chat pod here? These are just links you put in, Vishali?
Yes, sir. So it's the sort of resources that we typically share every webinar.
Okay, very good, very good. And so Clay, feel free to reach out to Deanna in Washington State. That's her email in the chat pod.
Already composing.
Okay.
And we'll try to get you a POC on the New York State DOT's IR app as well, or
Great, thank
IR
you.
program.
Yeah,
Okay.
we actually had Rebecca Becky from New York State on yesterday, but I don't think she chimed in on the VCC part or the IR the app part that you're suggesting, Vishali. But
Mhm.
the busy woman doing a lot of things. What else? What else? Anybody? We'll give another minute, 3 minutes. 3 minutes for any Q&A live from any of the 81 participants that we still have here today with
Or
us.
or if there's any information that you wish to share or announce in terms of TIM efforts, activities, successes, challenges.
Well, the one thing I didn't mention regarding the march to that million that our administrator Sean McMaster has tasked us with is you're going to see emails being sent out to the key contacts regarding the DFS webinars. So be looking for that in the very close future and be prepared. I've tasked Katie Belmore and her team to pull the data for all 50 states, DC and Puerto Rico, as to who the top training producers are from the states. So we'll be prepared with that information. And yeah, this I can't stress enough. We need each and every one of you that is involved with the TIM training uh, to keep doing what you're doing, and if not, you know, wake up your partners who haven't done any training lately. We need everybody to get involved and be a part of this effort. So,
And Jim, a couple of additional messages. One, what are the dates for these regional events? Someone asked for the top trainers within each state to meet, and I'm guessing those will be forthcoming. Is that
that's
right?
correct. That's correct.
Okay,
That's all coming out very, very soon. And
great. And
I
it,
will share one last thing in the last minute. We're going to try to give everybody, 10 minutes back in their day. But we're going to be conducting a 4-hour TIM responder training, either in Maryland or at DOT headquarters. And that's going to be attended by the administrator himself for, Federal Highway and possibly even NHTSA and Motor Carrier, with a number of responders in uniform. So that is going to be a big deal too, and something that's never happened before, ladies and gentlemen. This is the first time ever that we've had this kind of a push from the Federal Highway Administrator's Office. So with that, we're at 2:50. Anything else, Vishali?
No, sir. I think that is all. I just wanted to note that in the chat box, there is a really cool video, Touch a Truck recap video that I'm guessing is associated with the Crash Responder Safety Week in 2025. So for those that want to look at it, I think it's similar to Maryland's event that we debuted during last year to get the community engaged. And a final call from Jack Sullivan to start sharing secondary crash responder struck by events at reportstruckby.com. So that's it.
Okay, I see Tom from Florida asked a question about Sharp 3. Even though we don't use the term sharp anymore, but it's a fair question and an answer that I cannot provide, but we'll see what happens. We'll see what happens. Lastly, is the next Talking Tim. So fourth Wednesday of every month, correct? Or are we
Yes, sir.
doing every other month now?
It is in flux, but it is typically the fourth Wednesday of each month. It may be a alternating between Talking Tim or Crash Responder Safety Week or Tim self-assessments. But yes.
Yeah. And we do, and speaking of Tim self-assessment, my colleague Sharon Cueva was on today, who's the lead for the Federal Highway. She's part of the Tim team and great asset for us. And she actually leads a Tim self-assessment. And she has shared great information, news that a majority of states are participating and being very active with the self-assessment. So kudos to her and kudos to all of you that are involved with the Tim self-assessment. And lastly, I want to say the what is it? Gosh, not Talking Tim.
May I interrupt 1 second? One more question.
I'm sorry, hold on. What I wanted to say is for future Talking Tims, we are always looking for new and cutting edge activities, projects, devices, anything that you and your state are involved in to potentially present at Talking Tim webinars like today. Please send me an email and Vishali or Vishali and let us know what you'd like to present on. And you say there's another question.
Yes, our great friend Michael Youngblood has asked, can you confirm the dates for 2026 Crash Responder Safety Week? So I think we can offer the soft dates, but we will confirm and announce during the next Talking Tim. We were going to target the earlier in November, first week of November. Is that correct, Jim? November 2nd through 6th of 2026, which is the first week, rather than having it so close to Thanksgiving.
Yeah, I think we're still good with going with those dates. So just everyone stay tuned.
Okay, that is all.
There's a question here from Scott Woodburn. Are you including Canada, Ontario, and the state top trainers? We include Canada for sure. They do keep in contact with my office. So definitely include Canada, our partner to the north, in the great work that they've been doing. Thank you. I guess we'll leave it at that for now. Yeah, Jack Sullivan. I'll put in a plug for Jack Sullivan at Responder Safety Institute or respondersafety.com, Emergency Responder Safety Institute, to please report traffic incidents to the through the form, the traffic or the incident report form that exists on their website. All you got to do is go to respondersafety.com and go to the form if you're aware of any kind of struck by incidents, even if it just involves a responder's vehicle, injury, and God forbid fatalities, anything like that. We're looking for more and more of our community to report directly those incidents through that form at respondersafety.com. Okay, well, I lied, and we're only going to give you 4 minutes back. But regardless, thank you to our presenters, and thank you to Vishali and Kyla for their support and everything that you all do. Don't forget, you're saving lives, even though you don't always see it, because your forces, everything that you're doing to clear incidents quickly and efficiently makes a big difference. And you never know, could be the lives of a family member or friend or anything like that. So keep doing great things. God bless you all, and we'll see you next month. Bye-bye for now.